Dear students, welcome back. Now we are going to see the osteoarthritis of the temporomandibular joint. See here. Okay, so 80 to 90% of the population over 60 years of age have some symptoms of osteoarthritis of the temporomandibular joint. Normally, osteoarthritis usually occurs unilaterally, whereas this rheumatoid arthritis, that is an inflammatory condition which occurs to the structures, connective tissue structures around the temporomandibular joint are affected in the rheumatoid arthritis, like capsule, synovial membrane, and the synovial lining, and also the tissues which are surrounding, which are giving support to the temporomandibular joint are occurred. Usually in the rheumatoid arthritis it occurs bilaterally. Okay, so now we are bothered about the osteoarthritis. Normally this osteoarthritis usually occurs unilaterally. The primary cause of osteoarthritis is a repeated minor trauma, very minor trauma. So it is going to sum up. So all these minor trauma are going to add up to form a big thing. Okay, so trauma to the joint, minor trauma to the joint, particularly this trauma that creates an impact between the articular surfaces, the trauma in between the articular surfaces. One of the cause is loss of posterior teeth, which creates an internal joint environment, in which simple occlusion of the remaining teeth causes impact between the joint surfaces. So because of loss of posterior teeth, what will happen? So some space is created here. There may be a loss of this joint structure morphology. So to maintain that one, so this normally all the teeth are come in contact with each other to compensate that thing. It may be a simple occlusion. So once this contact between the teeth occur, the forces are created and which are transmitted to the joint. Again, it causes some stress on the temporomandibular joint. Okay, so the primary symptoms of osteoarthritis are pain. The primary symptoms of osteoarthritis are pain. On translation of the condyle, on the articular eminence, with almost pain-free rotation of the condyle, and flattening of the condyle and the articular eminence, and narrowing of the joint space, So these are the primary symptoms. One is pain on translation of the condyle, on the articular eminence, with almost pain-free rotation. So on rotation in the joint it doesn't have any pain, but on translation it is having pain in osteoarthritis. And also there is a narrowing of joint space occurs. So these are the primary symptoms of osteoarthritis. In more advanced stages of this disease, perforation of the disc So here you can see the damage of the disc, perforation of the disc, and lipping around the articular surfaces can also occur. So here you can see the articular surfaces are also damaged here. Okay, the normal structure of the condyle is not appeared. Some depression, some loss of bone here we can see in this condyle. Okay, this is an advanced stage. Okay, persons with osteoarthritis may limit their opening of mouth to the range available without translation. That means the opening of mouth is up to 11 to 25 millimeters. So where at that stage only rotation of the condyle is taking place, then what happens there, at that time no pain is there in the temporomandibular joint. So further opening it has to translate. In that position only, in the osteoarthritis, pain is getting. So the patients avoid the complete opening of the mouth. They will limit at the range of 25 millimeters of opening of mouth. Okay. So these symptoms will decrease over time with most pain disappearing. So with most pain disappearing after approximately 8 months and apparently normal function. So again they will have a normal function, but with crepitus is occurring. Crepitus means again some sounds. When moving this joint, you will get some sounds. Okay, normal function within 1 to 3 years. Okay, this is about the osteoarthritis. So normally at initial stages, the persons will have severe pain, and the symptoms will decrease over time, and also pain is disappearing after 8 months, and they will they will come to normal function after returning within 1 to 3 years. However, some crepitus is found inside the joint, indicating that the joint is having arthritis. So, but the pain is not present after 8 months, and also the normal functioning of the temporomandibular joint is also present, but some sounds, crepitus is present inside the joint. So this is about the osteoarthritis of the temporomandibular joint. And also you can discuss here only that hypermobility. That condition is called as osseous mobility. One is called as joint hypermobility, and also dislocation. So dislocation is almost having the same features of the displacement also here. Now, the temporomandibular joint which exhibits the hypermobility or excessive motion of the temporomandibular joint is common, found with both symptomatic as well as asymptomatic. So the hypermobility is a result of laxity of the joint capsules, and also the tendons and the ligaments. And this is commonly the joint hypermobility may be a generalized connective tissue disorder. So this is a generalized connective tissue disorder. That means every joint in the body is affected, so which includes the temporomandibular joint. Okay, so this hypermobility of the temporomandibular joint occurs in a condition called as generalized connective tissue disorder which involves all the joints of the body. Due to this condition, the temporomandibular joint is also affected. So, here the hypermobility shows some symptoms like the jaw goes out of place, goes out of place and produces some noises or catches when mouth is fully opened position, when the mouth is fully opened position. During physical examination of these patients with temporomandibular joint hypermobility shows an increased indentation, that means some depression behind the uh, lateral pole of the condyle, and this joint noises occurs at the end of mandibular depression. Joint noises are occurred at the end of mandibular depression and also at the beginning of elevation Okay, these noises may be heard by the person itself, and also when a clinician palpating at this area, he can also palpate the clicking or crepitus associated with these noises. So, hypermobility of one temporomandibular joint results in the deflection towards the contralateral side. So, if one temporomandibular joint is having some hypermobility, which results in the deflection of the mandible to the contralateral side, that means opposite side, when mandibular depression is taking place. Okay, normally this joint hypermobility shows some pathological changes like hypertrophy, atrophy or contractures in the lateral pterygoid muscles, that too in the superior portion of the lateral pterygoid muscles. Okay, so some of the investigators who found anterior displacement with reduction in patients reported more symptoms than reported by the persons with normal mobility or with disc displacement without reduction. So, with reduction, anterior displacement patients will show more symptoms than the persons with normal mobility and with disc displacement without reduction. Okay, normally the dislocation of the temporomandibular joint is usually temporary, and this can be resolved with joint mobilization. So this is about the hypermobility and the dislocation of the temporomandibular joint. Okay, these are about the dysfunctions of the temporomandibular joints. Thank you.